Welcome to the Wellness Author Show, where experts share their opinions on a variety of topics to help you balance your mind, body, and spirit. Catch the fever, the wellness fever, with your host, Don Mccauley.
Hello and welcome back to the show. This is your host, Don Mccauley. Today we're welcoming the program author and Dr. William Charschan, and he is the author of Cheating Mother Nature, What You Need to Know to Beat Chronic Pain. The doctor believes that you not only look like your parents, you walk like them too. Having the honor of serving thousands of people over the years, he wanted to share his knowledge to the public so they could be better healthcare consumers. Billions of dollars are spent on treatments in today's day that just simply do not work. And people want to have their problems resolved or prevented, not just labeled with classifications such as fibromyalgia. They don't wish to be taking drugs for the rest of their lives, and they want the joints in their bodies, such as their knees and hips, to last as long as they do. And they want to grow older in uncomplicated and healthy ways, and that's the point behind his book. That's what he's going to show us how to do. So, Dr. Charschan, how are you?
Great.
Let's start off with the big question. Tell us about this book, please.
Well, the reason I wrote this book is because, just like many of my patients, I was frustrated too. A lot of the things that I learned in school, you're supposed to do these things and they're supposed to work. And what I found out is it didn't work out that way. And quite honestly, I started to explore my inner self, and I said to myself, if we're so good at what we're doing, why are results so uneven? And that came the ideas for the book. And many years later, after studying the way people walk and dealing with a lot of runners and a lot of athletes, I came up with this idea that, you know what, people have to be educated to be able to do better in the healthcare system that we have and to be able to choose the providers that are most likely to be able to help them.
So who did you write this book for?
Anybody that's got chronic pain. Anybody who's ever had a knee problem, anybody who's ever gone to an orthopedic and being told that they need surgery, anybody that's ever been diagnosed with fibromyalgia, anybody that's ever had scoliosis, anybody that's ever had chronic neck problems, they all want to read this book.
So you're kind of bucking the status quo here in healthcare. Is that the central message of the book?
Absolutely, because the status quo is not only expensive, but it's dangerous, and there's many studies to show that many of the drugs, even the non-steroidal anti-inflammatories, just like the Nuprins and things of that sort, are actually not only dangerous, but long-term, they actually have a huge cost to society, and guess what? We all pay for that on a yearly basis with the increases in our health insurance.
Well, I think that everybody has this perception, that the people in the medical field have all the answers, and so it really doesn't make a difference who we go to. They all have the same pills, and they're all doing the same thing. So in your opinion, what's the most important thing that those in chronic pain need to learn before searching for the right doctor to help them?
Well, the first thing you have to realize is there's a lot of snake oil salesmen in healthcare. And many studies have been done. There's been articles. One of the articles was mentioned in my book about the New York Times, and they had shown that we're literally spending billions of dollars on back pain treatment that simply doesn't work, and the more money we spend on it doesn't make people get better faster. In fact, there are doctors out there like Dr. Sarno who had a book out in the early 2000s that suggested it was all in your head. And I've met some of Dr. Sarno's patients, and I can tell you, people who believe in that nonsense are part of the problem, and you can become part of the solution by understanding yourself better.
Now, you mentioned in the book that there's a common problem with most people that have chronic pain that's ignored by most doctors. Can you explain what that is?
Sure. The most common thing is the way we stand and the way we walk, and these are inherited traits. Now, there is a condition known as overpronation of the feet, where the feet flare out, and one foot, if it turns out more than the other, is going to actually create a lot of problems all the way up the body. Just like a building with a bad foundation, you're that building with that bad foundation, and just like a building with a bad foundation, you might develop cracks in the walls. Well, those cracks instead are pain. And what ends up happening is we see a lot of people who are in chronic pain just because they come in with a handful of discs and they say, I've seen all these providers over the last 15 years, and they've all done their thing, and now I'm seeing you. And the first question I ask people is, if they did such a good job, you and I would have never met, first of all. And second of all, the problem is everybody's looking at your parts and nobody's looking at you. And that's the central thesis of this book, is to start understanding you, to empower you to be able to find the providers who can help you versus the doctors who want to look at your knee, your hip, your back. Well, you're not a knee or a hip or a back. You're the collective parts that go into that, and the way we stand affects it, and that's kind of how we find ourselves in pain, by not recognizing that we have a family tree that's built that way.
You also make reference to the enlightened practitioner in the book. What is an enlightened practitioner, and how in the world do you find one?
The enlightened practitioner is the doctor of cause versus the doctor of symptoms. And Suzanne Summers, who has written quite a number of books on different health subjects, while she's not a doctor per se, one of the things that she has done in her own personal searching is look for a doctor of cause. The holistic idea, or the holistic physician, a holistic physician is not somebody who goes ahead and does all sorts of weird alternative stuff. A holistic physician is somebody who looks at the entire body, and that's what we call the enlightened practitioner, somebody who looks for cause, not just symptoms.
What is the popular myth and the truth behind fibromyalgia?
Well, the popular truth is that fibromyalgia is a chronic pain problem that's a disease state. Now, if you look on Wikipedia, Wikipedia will tell you that a disease is actually two words that were thrown together, dis and ease. And there's no such thing as a disease or disease is. They were made up based on these two syllables. And going with that idea, in 1990, there were a number of rheumatologists that got together in a room. One of my patients was actually on that committee, and they actually sat there, and they had all these things that they couldn't quite wrap their head around pain-wise, and they put them into a classification. That classification became known as fibromyalgia. The problem with fibromyalgia is it's not really a disease at all. In fact, it was made up in a room of doctors that don't really understand what they're looking at, trying to create a classification, because most medical providers, admittedly, including the ones that are my patients, say to me, listen, musculoskeletal ain't my thing. I don't really understand it. I get very little training in it, but yet I'm supposed to go ahead and treat it and guide patients as if I know what I'm doing. And the real problem is that fibromyalgia now gives them another tool to classify patients in a certain way, and we're selling tons of Lyrica, which is a drug to counteract the effects of the pain, but you have a lot of people out there that eventually have bad knees and bad hips and other bad joints, and we make replacements. We have all these great businesses that have spawned from this, but the problem is that we're not solving the central reason why people are in pain, and that's what this book does, is it says, here's why we're in pain. It's not a book that's going to give you a bunch of nonsense things to do on your own, including stretches. It's going to give you the tools to evaluate you and your family so you can make better choices and become a better healthcare consumer on trying to go ahead and live a good, healthy, and fruitful life.
You're saying if someone is diagnosed with fibromyalgia, basically, or essentially, what the doctor's saying is, I don't know what's wrong with you.
Exactly.
Wow, that's amazing.
Okay. Pretty intense, right?
Yeah, it is pretty intense, to tell you the truth. I mean, I think it really is. And so they've created a drug to solve a problem that we just don't know what the problem is, right?
Exactly.
Okay.
How crazy is that?
So, here's a question. Can you tell us what restless leg syndrome is and why traditional treatments never solve the problem?
Yeah, because what people have to understand is that most problems with the back are what we call gait issues. Gait is the way we walk. So if you have an irregular or an asymmetrical gait because of the way you're built, what ends up happening is we have this stuff called the fascia. And what fascia is it's almost like a sock that surrounds the entire body underneath the skin, and it surrounds all the muscles, and it surrounds all the organs. The fascia is actually more like an exoskeleton. It eliminates a lot of what we've learned previously, because guess what we do in an anatomy lab? We cut right through that. Now, I want to pass my test, so I'm going to learn muscle origins and insertions, but in the real world, it's the fascia that creates the muscular malfunction, not that. And fascia molds determine the forces by the forces we place upon it, and if we basically walk asymmetrically, the fascia in your midsection, also known as the core, will tighten up and literally glue you in place. And these people are miserable because what happens is they can never walk properly because we walk from our core to our knees and our legs. When you eliminate the core, all the force goes into the legs tighten up, we destroy our knees, we destroy our hips, and if you're a runner, which is one of the reasons I specialize in running, you have all these different problems now, and they come up with names like IT band and all these other things, and where it comes into restless leg syndrome is when you have that asymmetry, what it does is it creates stress on the sacroiliac joints, your hip joints, and that's what restless leg syndrome actually is. They've made drugs for this, which have horrible side effects, and I've never seen any case of RLS that hasn't gotten better by proper treatment of the core and by properly improving the way people walk using things like foot orthotics, which are shoe inserts, which are correct for that, and addressing the fascia.
Now, what is the U.S. Army-endorsed idiopathic secret scoliosis prevention exam that's discussed in this book?
Well, you know, the real interesting thing is from the 40s, they've always been evaluating in the Army people's feet. You may have heard stories about people who had flat feet who were thrown out of the Army and they were trying to get in and they wouldn't accept them. Why? Because they knew that people with flat feet would break down in combat. And even in today's Army, they're integrating chiropractors because one of the main complaints of people who are in combat or people in the Army are the fact that they have back problems. The reason that they do this is because they wanted to eliminate a lot of the people who have potential problems. And it's gait asymmetry that actually makes you most likely to have idiopathic scoliosis. And in my book, we actually talk about what idiopathic scoliosis really is, how it really develops, and from an engineering standpoint, it's pretty much preordained. So if we screen our kids not just for scoliosis, but if we also screen their feet too, which we do not do in high schools, you would start seeing a lot of kids who may have developed scoliosis may actually not.
Now, in your opinion, how can we improve the healthcare system so it delivers better care at a more appropriate cost?
Well, the first thing you have to do is doctors need to go ahead and start being more about the patient instead of the profit motive. Anybody can relate to this. You go to the hospital, you go for a small procedure. The facility fee alone was $3,000 for their half hour to hour for the procedure. The physician gets maybe $600 to $800. And the problem is that they've starved the physicians in many cases, especially the primary doctors, so much. They have to see 6 to 8 patients an hour just to be able to pay their overhead. So what do? They go ahead and they refer people to different specialists. Now, this over-specialization we have started in the 60s. And the problem that we have right now is that, especially with the elderly, a lot of times a physician really needs to spend 40, 50, 60 minutes, even in my office. I mean, sometimes the elderly take me a half an hour, and I'm only get paid for the 10-minute visit. So if you're going to penalize a doctor for doing the right thing, they're going to send them out of their office. And then the specialists look at the small parts. Well, the problem is we're not a kidney, we're not a colon, where somebody who has a kidney or a colon, but we have all these different things, and these parts are parts of systems. And if we don't evaluate the systems, we probably will miss the entire point. And the same thing that goes on with the skeletal system. But we've gotten to this point now, we send people to look at your parts. Well, you can't fix people by looking at your parts. You have to look at the whole. And one of the first things that we can do to fixing the healthcare system is go back to where we were in the 60s and say, hey, why don't we just pay primary doctors for their time, and then we stop reimbursing specialists as much as we do, and what's going to happen is your specialists are going to chase the dollar and become generalists, and the whole model is going to change where physicians actually spend time with you to understand you and understand the big picture, and I think we can solve a lot more problems that way with fewer tests.
That sounds like a good answer. Well, time is getting very short, so the most important question, where can we buy this book?
It's available on Amazon. It's available on BN. You can get it as a Kindle format on Amazon. It's available through CreateSpace as well, which is the publisher. And Alibris, I believe, also has it, as well as a number of other booksellers.
Could you pronounce and spell your last name for us, please?
Sure. It's Charschan.
This has been just very enlightening. Our guest today has been Dr. William Charschan, and he is the author of Cheating Mother Nature, What You Need to Know to Beat Chronic Pain. Dr. Charschan, thanks very much for being with us today.
Great. Thank you for having me.
This is